As the rollout of the COVID vaccine begins across the US, skipping the line and taking the jab before priority groups can bring significant problems. Healthcare and essential workers are at the top of the list, but there are concerns of a black mark being created.
When the coronavirus vaccine is first distributed, there won't be enough for everyone who wants it. The first two groups of people slated to get it are healthcare workers and residents of long-term care facilities. After that, it will go to other priority groups, such as other essential workers like bus drivers and teachers, and those who are at higher risk for severe effects from COVID-19. Here's why you shouldn't try to jump the line. First, it's not fair. Those who skip the line will end up using a vaccine that someone else needs more. An ICU nurse, for example, takes care of patients with coronavirus, and we need to protect our nurses to have a functional healthcare system. And about 40% of those who have died are people who live in nursing homes, who are a particularly high-risk group. The CDC's role is to provide recommendations on who gets the vaccine, in what order. How vaccines are then allocated depends on each state. And while they typically do, states don't have to follow the CDC recommendations, so there may be some differences state to state. Initially, enforcement is easy. For example, healthcare workers will get vaccinated in the hospital they work in. After that, it gets trickier and will depend on each state's rules. I expect some locations may require documentation to prove that you meet certain criteria, while others may rely on an honor system. Here's a second reason not to jump the line. A black market could develop. We are already seeing this happening in some other countries. All coronavirus vaccines in the US are ordered through the CDC. If you get a vaccine outside of this process, there's no guarantee that what you're getting is actually the authorized vaccine. The federal government will do its best to try to protect against this black market, but it only works if people cooperate and not drive up demand by trying to cut in line. It's really important to avoid internet scams and get your vaccine only from doctors' offices, pharmacies, and other approved locations. One more reason to wait our turn. Remember that even if you get the vaccine, you still have to keep up masking and social distancing. The vaccine works to reduce symptomatic illness and severe disease, but we don't know whether it works to prevent transmission of coronavirus. It's great that so many people are so excited about the COVID-19 vaccine. If about 70% of Americans take it, it could put an end to the pandemic in the United States.